Apollo Hospital, Bannerghatta today unveiled Seniors First, a transformative healthcare program tailored exclusively for senior citizens. Yes, my dear friends, as a Karnataka's first integrated geriatric care intensive, Seniors First is designed to help the elderly lead healthcare, happier and more independent lives through a thoughtful blend of preventive care, proactive wellness, and structured recovery after major healthcare events. Shri Dinesh Gundurao, Minister of Health, Karnataka, launched the intensive standing Apollo Seniors Fest.
Take immense pleasure to welcome you all to this special occasion. We are gathered here today for a cause that touches the families, the health and well-being of our elders. So as the saying goes, a society that does not value its older people denies its roots and endangers its future. So caring for our elders is not just a responsibility, it is a privilege and a reflection of our values.
So thank you very much for that insight into it, and you've been at the all of the geriatric care in the country. Thank you for those wonderful insights that we got from you, and I'm sure as a part
chronic kidney disease. He is being managed, he comes to the hospital, gets admitted, treated and discharged. Now he goes home, post-admission, post-discharge the third day, he is a little breathless, he is a little confused. The wife is all jittery, she does not know how to handle. Her son, her only son, has left to the US because all was well. The last hospital visit was unremarkable. The OPD follow-up was unremarkable. So she's totally lost. Who does she go to? These are stark realities, that stories that we hear as geriatricians every day. These patients, they can avail of a doctor's services the next day, but these doctors are probably not very well aligned with the treatment because these patients have a lot of complexities, multiple problems, multiple medications. These are one of the major problems in geriatric medicine and geriatric patients. Each medicine can have an interaction with other medicines. Each medicine can have side effects which are often misconstrued as a new symptom. So unless these issues are very well managed, coordinated well with the other treating physicians, often the treatment is suboptimal. The other problem we often see is frailty. Frailty is defined as a state of vulnerability to a person due to decreased physiological reserves. Because of this, you may find 70-year-olds who are pretty sick, need help for his supports, and you might find this 85-year-old person who's all active and robust. Because it's not the age, it is the frailty level that determines your health outcomes. A one-size-fits-all approach does not work in geriatrics.
Mental wellness and nutritional counseling, and at-home services which would include nursing, physiotherapy, home diagnostics and much more. We also understand that senior care is not one-size-fits-all, and therefore we have developed two types of plans. One is wellness plan, which is going to focus on overall prevention and well-being. Then we also have acute.
That what business this judge has in this program, and therefore madam is right in her lisp. Long lectures are not that entertainable, said Dale Carnegie, great American author of that How to Win Friends and Influence People. He was asked, which is your next book? He said, how to antagonize people and distance friends. And the public asked me, how we will do that? By giving a long lecture. Therefore, I want to be as short as possible. Dignitaries on the dais. I feel honored that you have invited me to share the dais and to say a few words from the podium. As a judge of the High Court since last more than 7 years, and as a lawyer before my elevation for 25 years, I have seen the the predicament the persons in the evening of their life are placed by the fate, less, more by those who ought to have taken care of them. Our Smritikara said, Pita rakshati kaumare, Bharta rakshati yauvane, Rakshanti sthavire putra. The Smritikara was concentrating more on women. When child, father will look after. Pita rakshati kaumare. During her youth, husband looks after. Bharta rakshati yauvane. Rakshanti sthavire putra. This is very important. Sthavira in Sanskrit is old age. If we live long, we are bound to become old. Nobody can escape old age unless one dies earlier during the earth itself. The greatest disadvantage of modern civilizations, which a great psychiatrist Sigmund Freud, Carl Gustav Jung mentioned, is neglecting the old people because they cease to be productive. They are useless to us. So persons who are in the old days are being ignored, not only in any particular part of the globe, but everywhere. This is the reality. Bible says, look after your aged parents. Prophet also said, you look after your parents. And our Smritikaras, our civilizational values, they always injuncted people not only to respect old people, but to take care of them. They have seen in our scriptures where Shravanana Pitru Bhakti, Shravana, he carried father and mother, in fact, on his shoulder, because they expected, both they were blind. They say, take us for pilgrimage. And he took. They were very, very thirsty. They said, Shravana, we are thirsty. Well, Papa, Mama, kindly wait here. I'll fetch water from nearby. He went to a particular reservoir to fetch water. And when he was filling that pot, the sound which Dasharatha of Ramayana, Lord Rama's father, felt that some wild animal has come there. Therefore, with Shabda Vedi, he had shooted an arrow which ultimately killed Shravana. And when dying, Shravana said, even Dasharatha felt so bad. He said, I am dying. I have aged parents there. Kindly look after them. It was the duty of the patriarch, the king, to look after the aged people. The aged people have many problems. In fact, Parliament has passed the Senior Citizens Protection Act, which imposes a duty to look after aged parents. Now, I'm told, in fact, I wanted to address the Honorable Minister. I wanted to tell him that the government is thinking of bringing a legislation to protect the old people. By one of the measures is to deprive children who do not look after the parents, aged parents, from inheriting the property. But this is not a good development. This is deterring. We have come to that level now. This is very, very bad. When we see the programs like this, the plans like this, the visions like this, we feel very, very happy. We feel really happy. At least Something is being done. This problem is there in America also. This problem is there in America. But the level of governance, quality of governance is comparatively appreciable. There the protection takes place. But in Asian countries, generally, much more needs to be done. This is being done. Therefore, when Dauda told me that I should come and I should share a few words with you people, I said I will apply for leave. I applied for leave today because today happens to be the compensatory working day for us. With all happiness I came here. I thank you so much, and really we should appreciate the organizers and Apollo.
Ready. Honorable Justice Krishna Dixit, Dr. Madhu Shashidhar, Steve and friends. It gives me immense pleasure to be here on this occasion when Apollo hospitals are rolling out an initiative to make their hospitals senior friendly. I'd like to thank the Apollo Hospital management and Dr. Steve Paul for this invitation. This initiative comes at an opportune time when, as we know, the Indian population is rapidly graying and the birth rate continues to fall. This era is potentially a golden age for the elderly. Information technology and the internet have made information and services easily available for the elderly. Mobility aids have made mobility easier. Healthcare services have improved dramatically to improve quality of life.
To all of you, esteemed guests on the dais, all of you who are here, let me maybe start with talking about why should we do geriatric care, right? Why is Apollo today launching this geriatric care program? So if you look at the past 50 years in India, a child who was born 50 years back and a child who's born today, the life expectancy has doubled. A child who's born today can expect to live twice as long as a child who was born 50 years back. Why has that happened? It has not happened because of medicine. It has happened because of reduction in infant mortality. We have markedly reduced infant mortality in this country. We have improved sanitation. We've improved vaccination rate. Childhood mortality has decreased. Agriculture has improved, nutrition is better. All of these has resulted in a substantial increase in that life expectancy at birth, which means that unanticipated early death has been delayed. Our elderly population is increasing in size. Morbidity, illness has now shifted to the last 2 decades of life. This phenomenon is called the compression of morbidity, which means that the last 2 decades of life are packed with illness. And therefore, it is incumbent on us that we develop mechanisms to take care of patients at the later stages of their life. Now, this is not just the same illness that happens later in life. A myocardial infarction, a pneumonia that happens in the last 2 decades of life is incredibly different from a young person having pneumonia. Our doctors have talked about frailty, decreased physiological reserve, the likelihood of developing complications in the hospital like kidney failure, delirium, and so on. So we need an entirely different specialty to take care of these patients because disease presents differently, behaves differently in the later stages of life. Secondly, there is an entirely new set of diseases that only presents in the later stages of life. Degenerative diseases of the brain, macular degeneration, joint diseases, these do not occur in younger patient populations. These are exclusively diseases of aging. And lastly, when our elderly population has an illness, the time to recovery is longer. The need for post-acute care is longer. The need for services like rehabilitation is higher. Therefore, we need a coordinated, specialized service, a geriatric program. So we are launching geriatric program because it's the right thing to do. I really want to thank the Honorable Justice, Mr. Dixit. In the few minutes that I was able to spend with him, I learned that he has been instrumental in passing the law that protects health caregivers from violence in the workplace. So I would like you all first to please acknowledge that. Thank you. and every time he explained one of these to me, he explained that through the prism of dharma and the right thing to do. So that is a remarkable way to look at it. So we do geriatrics because it's the right thing to do. And I also want to thank the leadership of Apollo, the vision of the chairman, the leadership of Ms. Preeta Reddy, Ms. Sunita Reddy, who from the day I started in this organization has asked me, Madhu, when are we going to start geriatrics? It is their vision, the commitment to patient-centered care, keeping patients at the center of everything that we do, that allows us to do what is right for the patient. I also want to thank the team, Manish, Dr. Manish, Uday, Dr. Yatish is not here, and Kashmira, who's not just the MC but has been instrumental in getting this program through, and the entire team at Bangalore that has worked very, very hard to bring this program to bear. So thank you all.
Life, care of the elderly. Madhu commented about longevity, living longer. We're all living longer today. Of course, we're living longer compared to what we did 40 years ago, 30 years ago, 20 years ago. The average lifespan today is about 70 years old. And it's only gonna get better. But is it just about living longer? Or is it about living better? I think it's about living better too. Let me take you back to what health actually means in Sanskrit. Samadhosha, Sama Agni Samadhatu, Malakaryaha, Prasanna Atma Indriya Mana. Look how precisely our system defines health. It is not about just living longer, it's about living well. Samadhosha, Vata, Pitta, Kapha. Sama Agni, the Shitas and the Ushnas. Sama Dhatu, look at every component that is taken care of in our language. Steve would tell you the impact of loss of muscle mass, the impact of loss of blood, the importance of bone marrow, the importance of every aspect has been detailed in fine nuances when it comes to our Ayurveda. So the balance that we strike between the doshas, the agnis and the dhatus is very important for us. Mala karyaha. Imagine, they also concentrated on the functions of the body, the excretion of sweat, the urine, the toileting. So vital for us to be happy. Prasanna Atma Indriya Mana. How nicely it has been put out. Look at the English version. What is health? Sir was talking about Sigmund Freud. He spent about 30 years looking at what actually is health and wellness. And they went on to define it's a balance between the physical, physiological, and psychosocial well-being. So you understand the richness where we are coming from. So I'm so glad that we have taken up this topic about talking about the elderly, not only just about living longer, but also living well. Having spent about 2 decades in the West, the care of the elderly is so vital. I deal with people who have cancers, I deal with people who have gut problems. And majority of our patient group comes from the above 60s and the above 70s. Let me take you back to my British days. And there was a place called as Eastbourne. It's somewhere tucked in the southeast of Britain around the Kent, Surrey, Sussex coast. The average lifespan of a person there was about 88. 88. People used to retire to Eastbourne for a better life, for a better quality of life. And the district hospitals there had this phenomenal concept of providing care for the elderly, taking care closer to home, taking care of them, in such a way that they really wanted to retire to Eastbourne, because I think that is what the fineness of the healthcare system was. And I'm so glad here that we at Apollo are taking a call to take that comfort care closer to home and put everything together so that the last years of life are meaningful, healthy, and not only about just living, but living well. Care of the elderly.
There's something to learn from them. Their wisdom is what carries us through life, as was shared by our Honorable Justice. I think in the name itself, why we are putting seniors first is it underlines the importance of going to them, bringing care to them, rather than having them navigate the challenges of consuming healthcare across our components of service that we provide across the Apollo Group and even otherwise. At Apollo Home Care, we are committed to building a product platform that brings care, the best quality of care, standards, etc., right in the patient's comfort zones. And I think seniors would sort of value and benefited the most from this one. In our journey that we have sort of traversed over the last 10 years in building a specialized home healthcare platform for people across not only Apollo patients but even otherwise, we have realized this, that the platform in itself underscores the importance of convenience, but at the same time it's also important to put in as many services that we can deliver to them and not just do a few products or solutions. And as Dr. Gundu rightly said, let the care come to them instead of them sort of figuring it out. Thank you so much.
Especially to be part of this inaugural program, Apollo Seniors First, which is truly significant, and to me it's a leap forward in the whole ecosystem of what Apollo does. I would like to extend my deepest gratitude to Sri Dinesh Gundu Rao ji, the Honorable Minister of Health and Family Welfare, the Government of Karnataka. I'd like to acknowledge the presence of Sri Krishna Dikshit ji, who is the Justice of High Court of Karnataka, and his speech was tremendous, a lot of learning and deep knowledge in the Vedas and mythology, and it was wonderful listening to him. I'd like to thank Dr. Prasad Matthews, Senior Professor, Geriatrics, CMC Vellore. CMC Vellore has been an organization which we have looked at with respect for their knowledge and their clinical acumen, and to me that is definitely the North Star of healthcare, not only in India but for the rest of the world. Dr. Madhu Shashidhar, who leads with passion and who is our President, Healthcare Services. Dr. Steve Paul, I'd like to thank you and Kashmira together for being the first ones to do it in the Apollo ecosystem. And I think this is targeted at making a difference to people, especially at a time when they really need it. So thank you for being there. And Vishal, the head of our home care, I'm so glad that everybody is coming together in the service of me. At the Apollo Group, of course, we've done cardiology, we've done it really well, and there's so much more to do. We've raised the bar on how healthcare is delivered there. There was a deep focus in the oncology space, in the intensive care space, and multiple spaces where I think, we've looked at outcomes, we've monitored outcomes, we've benchmarked ourselves with the best in class globally and said, can we do something a bit better? So we did that. And then we said, the pharmacies, there was a time when we did not know if the drugs were good or they were spurious drugs. So there was a deep-seated effort into building a pharmacy chain, simply because we could at least ensure the quality of drugs which were being given to the public. During the COVID time, we found that healthcare could not, people could not travel distances for healthcare. We needed to give healthcare at their doorsteps, literally in their hands with their smartphones. And that's how our whole digital enterprise came into being. And I think God has been kind and the institution has done well, simply because we have great leadership in place, and our management team, the people who work on the ground, do it with a sense of passion. But of late we've been realizing that while we do this and while we are doing very well in what we're doing, our karma and our duty has been to look after the seniors. In school, all of you went to school and you loved being called a senior. Everybody wanted to be a senior in school because it was glamorous, it was cool, it was fantastic. But at this point, none of us want to be called a senior. So life comes a full circle. And we say now we don't want to be a senior. And why is that? Because we look at seniority with a sense of fear, with a sense of trepidation, with a sense of uncertainty, and so it
gives me great pleasure to be here on the launch of the first integrated geriatric care program that is being thought of by the Apollo hospitals, the Seniors First program. which I think is something which is really the need of the hour, and I think it would really help in providing a complete healthcare package for the people who are the elderly and the seniors. I want to thank Apollo Hospitals for calling me for this event, and we just heard Doctor. No, are you a doctor also? No, okay, sorry.
Not a medical doctor.
Okay, Dr. Preeta Reddy over here, and she's met her before, and she's an able leader and in the footsteps of her illustrious father, Dr. Pratap Reddy, and continuing the legacy and ensuring that the Apollo Hospitals, the Apollo name continues to grow and flourish and bring about many more innovative and creative ideas which will help in providing better healthcare to our people. Of course, Apollo Hospitals is one of the leading brands in this country in healthcare, renowned and known all over. And I think you go to any capital city, Delhi, Hyderabad, Chennai, Bangalore, of course, and many other cities. They have their hospitals, and in many other towns also they have their hospitals. And they have pioneered many research work also, and I think cutting edge technologies which are available across the world, around the world, has been brought to India, and people of this country have been able to access that. And today it's not just the people of India, but I think from all over the world people come to India to get themselves treated, because availability of expert renowned medical professionals and good facilities, and also at a reasonable and low cost. So I think that is India is becoming a capital for healthcare, can really fully grow also and using this potential. And I think in that aspect, Apollo has really contributed to the country in providing these wonderful facilities which attracts the global people to come over here and use our facilities. So saying those few words, I'm very happy that the Seniors First program is being launched today, and India being it's not an aging country. I think people above 60 years constitute about 10% of the population, and and of course this 10% is only going to increase, and by 2050, that is in another 25 years, this 10% is going to become 20%. So the percentage of the aged and the elderly is only going to increase, and I think by 2067, around that time, the population will start aging in this true sense, and we're going to have like what countries in the West are facing, India will start facing that problem. So we need to prepare ourselves for this eventuality of extended health lifespans, and people who will be able to live longer. And of course, as you live longer, at some point of time or the other, however healthy you may be, some issues will crop up, diseases will come, chronic illnesses will eventually be part of your life. And how we take care of that, how efficiently we can look after our elders, that I think becomes a very key component of healthcare. And I think this facility that is being launched here is something that makes healthcare very convenient to the people who are suffering, who are aged, who are the seniors. And I think that makes a big difference, because it makes, when we talk of ease of doing business, we obviously should also think of how we can provide our customers and not customers, I would say, provide our people ease of getting things done, ease of coordinating things. There's so many issues which are connected. And I think in that aspect, this kind of an approach, which looks at it in a holistic way, I think it's not just treating a patient because they have some illness, some chronic disease, whatever, but also how we can give that patient enough emotional support, enough logistical support, so that as you grow older, you need more, these kind of support systems. And having someone who's like a points person who will coordinate things for you, who will see that things are being done, or who's monitoring things for you, depending upon the person's disease. Just now, as you said, there's so many various stages. Some are very faint, some are in between, some are critical. So each person has to be looked at in a different way. Some will require probably even regular daily monitoring, even though they may be in their houses. So how do you take that healthcare to their house, to their once they're a patient? It doesn't mean that once they leave the hospital they are not out of your hands. I think when they're in their houses also, they're still in your hands. So you need to look after that, look after them, and keep the best available treatments going for them. And also wellness, I think that is a component which you've included. So how do you make them more healthy, and how do you make them more emotionally and physically more to be more capable, to be able to do things better, and to be able to lead ultimately, what is the end game? To lead a more fulfilling life. Because as you grow older, what becomes more important is how much you can enjoy the life that you're leading. Whether
to the last mile to the rural crowds. Thank you very much, sir, for your time. Really appreciate, despite your very, very busy schedule, you made it today. I appreciate that. I would also like to thank Justice Krishna Dikshit. He's also very busy, as he rightly said while he was speaking. He said today was a working day for him, but he wanted to be a part of this special program that we launched today. So we thank sir as well for being here on this time.